I'm KHIDI from National Cancer Center, Korea, and I'm really sorry for my short English. So please pardon me. Well, for the background, let me start with cancer epidemiology in Korea briefly. Well, in Korea, the total number of new cancer cases in 2016 is 229,180, and for male, 120 over 120,000, and for female, over 100,000 cases. And the age standardized cancer incidence rate in 2016 is 286.8. Cancer incidence increased from 1999 to 2011 with about 4% increase per year. And from 2011 to 2015, the incidence slightly decreased. And in 2016, compared with year 15, cancer incidence increased about 6%. And this is the figure of the overall cumulative risk of developing cancer from birth to life. So the expectancy was about 36.2%, and the risk was higher in men in 38.3% than in women in 33.3%. As you know, the stomach cancer occurred most frequently in Korea, accounting for 13.3%, and also in males, stomach cancer occurred most frequently, and for females is the fourth leading cause. This slide shows the trends of cancer incidence from 1999 to 2016. Only breast cancer increased from 1999, and the stomach cancer and all other cancers are in decreasing trends. And this is the international comparison of incidence of cancer, so that Korea is lower than the average of OECD countries and the United States. And compared with Korea with US, Korea has a significantly higher incidence in stomach cancer in both sexes. And the portion of deaths from cancer is 27%, and the cancer is the first leading cause of death. And according to the cancer sites, lung cancer was the leading cause, and followed by liver, colon, and stomach cancer. And the age standardized mortality rate in Korea is 94.5. And for stomach cancer, the mortality rate is 9.6. This is the 5-year survival rate. The 5-year survival rate, survival rate from 2012 to 2016 was 70.6%. The survival rate shows a steady improvement, and so we can see that the more than half the current patient in cancer in Korea survive for more than 5 years. So it is the summary. Stomach cancer incidence is declining, but still most common cancer in Korea. And Korea has high incidence of stomach cancer compared with United States. And stomach cancer is fourth leading cause of mortality. So I'm going to introduce our screening program. In Korea, national screening program initiated at 1999 for 3 cancer screening: stomach, breast, and cervix cancer. And then in 2003, the liver cancer screening was added. And 2004, colon cancer screening was added. So from then, The program started to cover 5 cancers: stomach, liver, colon, and breast and cervix. And National Cancer Screening Program is managed by 2 systems depending on cost coverage, by depending on individual income level. Who are lower 50% of income, they are covered with Medicaid, so they screen without payment. They screen in free of charge, and per 50% of income level, they are covered with national health insurance, so they pay about 10% of the cost. And this is a diagram for stomach cancer screening procedure. People aged more than 40 years old are recommended to examine with endoscopy every 2 years. And if endoscopy is not visible, it may perform with upper GI series. And this table shows age-specific cancer incidence rate. The blue line is for stomach cancer. So it shows that the stomach cancer incidence is starting to increase at age 40. So it can be an evidence of start screening at age 40. For initial stage of national screening program, EGD and upper GI both were the screening modality of stomach cancer, but currently it changed to endoscopy as a main modality because the detection rate of early gastric cancer by EGD is higher than that of upper GI series. And in Korea, the EGD costs are very cheap, and that the cost of unsedated EGD is similar to that of upper GI. So in Korea, the EGD is a very cost-effective screening modality. And as you all know, the survival rate differs by stage in stomach cancer. At localized stage, the survival rate is high as 96.5%. Is in Korea, but at the distant stage, the survival rate rapidly decreased at 5.9%. So this table shows difference of early gastric cancer portion between screening-based and hospital-based endoscopy. So the top is the screening-based. Screening-based endoscopy has resulted in a higher portion of early gastric cancer compared to hospital-based endoscopy. And the incidence of gastric cancer was decreased about 50% in the repeated EGD screening group versus infrequent screening group. And gastric cancers detected by EGD within 2 years and earlier negative EGD were mostly early gastric cancer. And more than half of them could be treated by endoscopic resection, which allowed a better quality of life and surgical resection. So National Screening Program recommended to perform EGD every 2 years in Korea. By encouraging cancer screening through media and by offering free or low-cost screening, the rate of participation has been increased from 11% to is maybe 72%, is including the opportunistic private screening, but it's very high we have a very high participation rate. So this is the 5-year survivor rate. With increased participation in gastric cancer screening, and the number of patients diagnosed with gastric cancer has increased and resulted in a higher portion of early gastric cancer. This may result to increase 5-year survival rate from 42% to right now 76% in 2012 to 2016. So it is the international comparison of 5-year relative survival of major cancer sites. Stomach cancer survival rate in Korea is high as 76%. And compared to United States is 32.1% and Canada 25%. And other blue-colored cancers, which are covered by national screening program, show the high level of survival rate compared to other countries. So I think national screening program show the very good results right now. So, and in addition to current program, we are starting lung cancer screening at the end of the year this year. And at our institute, NCC, we perform gastric cancer screening for 20,000 national screening cancer program, and for 7,500 private screening per year. So this is my end of the presentation. Thank you.